So we can stay on time. I'm going to start the meeting. And folks, if you want to finish getting your food, there are copies of the applications being distributed. I'm going to go ahead and have Charlie call the meeting to order and ask the clerk to call the roll.
Aaron Ammons. Here. Bill Brown. Eric Jacobson.
Here.
Dean Hazen.
Here.
Jared Miller.
Here.
Dennis Roberts.
Here.
Mary Alice Wu. Mayor Marlin.
Here.
And Danielle Chenoweth.
Present. Great. So next, if there are petitions, we are going to hear presentations from the different social service agencies. Thank you for coming out this evening to speak with us. If there's any member of the public here to speak, this is the petitions and communications portion. So if anyone wants to speak before we hear from the social service agencies, just raise your hand. Okay. So we'll move on to the presentations. I'm going to have our staff introduce the folks who are going to be presenting. I think in each case it looks like, is it 9 minutes?
Yes.
Okay,
5
and-
minutes for presentation and about 4 minutes for questions. And Matt Rejic will be keeping track of the time and noting.
Okay.
How
And
much,
since
so.
we have a township meeting at 7 and a council meeting, and we want to have a little break, so we're just going to try to keep on time. So, Matt, thanks for the timekeeping. We'll keep moving. If you can give folks like a finger when they have 1 minute, that'd be great. Thanks. Go ahead.
Okay, so the first agency is Big Brothers Big Sisters, and Corey Burrows will be presenting.
I heard that, Matt. So, my name is Corey Burrows. I'm the Chief Operating Officer for Big Brothers Big Sisters of Central Illinois. I want to thank you for allowing us to be here tonight to talk about our program and also about our funding application. So, giving you the brief history, because that sounds like about all the time we have, is that Big Brothers Big Sisters is the oldest, largest mentoring organization in the country. We have a 100-year history of providing mentoring services for children that are facing adversity in their lives. Here in Champaign County, we've been here since 1999. And over the last 18 years, we've provided mentoring for thousands of youth here in the community. As far as the children that we serve, we work with kids that are considered facing adversity. We don't like to use the word at risk, but more that they're facing adversity or obstacles that can hinder success. And those can be anything from growing up in a single-parent-headed household, living in poverty. Unfortunately, at times they've experienced incarceration of a parent, have been exposed to criminal activities or abuse issues within their homes. What we do is we work to provide a caring adult role model who then spends quality one-to-one time with that child, helping to provide guidance and support. We work very closely with the families to identify the needs of the child to make sure that we are meeting the needs of each individual child at their level. As far as our program, it takes professional case management staff to provide our services. There's a lot of steps and infrastructure that is needed for mentoring to be successful. So we have to have trained professional case management staff that are on staff that provide the screening, the training, interviewing, ongoing case management support for each one of those mentor-mentee pairs that are made in our program. That requires a lot of time, requires a lot of effort, but the two things that Big Brothers Big Sisters focuses on is child safety, number one, but then positive outcomes for the youth in our program. Last year, the outcomes showed that with our program, 98% of the children that were involved in Big Brothers Big Sisters were promoted to the next grade on time. There's a lot of work here in the community that's being done as far as cradle to career and looking at making sure that children are graduating from high school on time. And one of the biggest things that can deter a child is not being promoted on time to the next grade. As far as other things, 100% of our children avoided juvenile delinquent behaviors. 64% of them improved their grades after being matched with a mentor. and 84% of them avoided truant behaviors, which we know that's another huge factor in determining a child's success in school. As far as our application for funding, we are asking the council here to consider funding a full-time case manager. For us, the number of children that can be served is dependent upon the number of staff we have. Case managers can only handle a certain number of full-time caseloads, so a full-time case manager can handle between 60 to 90 matches, what we call a mentor-mentee pair. And so for every full-time case manager we have, we're able to serve 60 to 90 more children per year. Last year we were able to serve 55 children within our program. So with increased support from the council, we would be able to increase that number of children served. And so I will cut it off there. I already got the warning, so I'll answer any of your questions.
Any questions?
Yes, sir.
Where are you guys located at?
We actually have an office in the United Way building,
Sorry, that's,
404 West Church Street in Champaign.
okay, thank you.
Any other questions?
Just one.
Go ahead, Chair.
Sure.
What percentage would what you're asking from the city end up being as far as your total budget?
So the total budget in the application was $301,000. The total amount that was asked for in the application was $50,000. So we'd be, asking for approximately, I think, 17% of the budget, total budget
Of your total budget for
of
the
our
year?
total program budget for Champaign County.
Okay.
Our agency budget is $951,000.
Okay. All right. Thank you.
Go ahead, Eric, and then Dennis.
Have you been hit in the past year by the problems with the state?
So, Big Brothers Big Sisters, we do not receive any sort of state funding, but I think all social service agencies are feeling the effects of the budget cuts by the state because, unfortunately, what has happened is the market has become saturated with additional special event fundraising, additional donor cultivations, additional corporate cultivations. So I think what we're seeing is while we didn't lose any state funding, our own special event funding and donor funding is maybe down a little bit. And I think that's just because of, all agencies are working hard to try to get the money they need to serve their clients.
Okay. Dennis, did you still have a question? I'll jump to Aaron and then back to Dennis.
What was the amount that you all received last year from?
I believe we were funded at right at around 15,000.
And while we're waiting for Dennis, I had a quick question. Do you have demographic information about both your staff and the folks who are served?
Yes. Right now, our staff, as far as, are you looking for
So race and ethnicity.
race, ethnicity? Right now, our staff is 100% Caucasian. The African American population in our program is around 52%. Caucasian is around 35%, and then the rest is made up of multi-race and a very small Hispanic population.
Okay. Other questions? Dennis, you had it? No?
Yeah.
Dean?
So it sounds like you have, I'm reading, you have, you mentor 85 students?
That would be our projected if we were to receive full funding. This last year, as of the time of application, we had served 55.
And you have a waiting list. It says here you've got 25 Urbana youth identified as being possibly served by the...
They're currently on
program.
our waiting list. So whenever you look at our program, we have our current matches that are actually children who are paired with a mentor, and then our waiting list of youth who have been through the entire process that are waiting to be paired with a mentor.
And how many did you work with from the Urbana neighborhoods last year?
As far as those 55, all those 55 children served with the grant funds were from Urbana.
I gotcha. What's the age levels that you work with?
So
Okay, time. All right, sorry.
that's right.
That's it.
Yeah, I think we're at time, just so we're actually a little bit
Sure.
over. I think the age level information's in that application.
Thanks, Doug.
And Dean, is it okay if we move on, or do you have something urgent?
Yes, my pleasure.
Okay, great. Wonderful, so thank you.
Okay.
Appreciate it.
Thank you very much for your time.
And next, Claudia Linoff with Champaign County Healthcare Consumers.
Good evening. My name is Claudia Lenhoff, and I'm the Executive Director of the Champaign County Healthcare Consumers. First of all, I want to thank you all for actually doing social services funding. Healthcare Consumers is grateful for this opportunity to apply for your funding program once again this year. We are applying for support for our Client Services Program, which is a free social service provided to community members who are experiencing difficulties with health care and access to health care and social services, and who need help applying for health insurance, various benefits, maintaining those benefits, affording prescription drugs, and so on. A huge amount of the work that we do involves helping community members, individuals as well as families, apply for and maintain their health insurance coverage, including marketplace coverage through healthcare.gov, as well as Medicaid coverage. This past year has been especially challenging for many community members as the local, state, and federal health insurance landscape has been changing rapidly. Many of our clients have required additional time and services as they navigate the changes in Medicaid managed care and state of Illinois employee health benefits and retiree health benefits, and as they age into Medicare and also have to find their way through Medicare Part D prescription drug plans. It's increasingly important to help our community members retain their health insurance, avoid gaps in coverage, and a lot of the work that we do is providing the consumers education and case management services that help them to stay covered, but also help them access healthcare services and learn how to use the healthcare system if they've been outside of it, including mental and behavioral health services, which are now increasingly available because of the Affordable Care Act and the expansion of coverage. Every month, our staff, who we refer to as community health workers, who have very specialized skills, help over 580 clients by providing case management and coordination, information and referral, advocacy, and interpretation and translation services. Most of our clients do receive case management services because case management is required to help people continue to maintain their health coverage. Urbana residents are consistently about 41% of the clients we serve, so that's about 230 some per month, with about 142 in case management. We are good partners with the City of Urbana and Cunningham Township. We've been working with the city and the township for many years. Not only have we been a township workfare site for many years, but we also routinely help township clients apply for health insurance, food stamps, help them afford their prescription drug benefits when they can't afford the co-pays under Medicaid, and help them with other benefits and services, including sometimes with disability applications and getting the documentation they need. The vast majority of our Spanish-speaking clients are Urbana residents, and because of this growing base of clients, we have made a concerted effort to have bilingual community health worker staff. 3 of our 5 program staff are bilingual and fluent in Spanish and English. So we are certified and trained to help people apply for health insurance, access primary and specialty care. We routinely help people apply for hospital financial assistance and also to get help with prescription drugs. And we have a prescription drug fund that we started because a lot of times even with insurance people couldn't afford the co-pays for their prescriptions. We help people get access to dental care, all kinds of vision, other services like that. We help people apply for food stamps, SafeLink free phones, bus passes, and of course the array of Medicare insurances. Funding from your program has been instrumental in our ability to build our capacity to provide these services.
You've got a minute?
Okay. Retain experienced staff and attract additional funding. I will actually just stop here. I have more details, but I will just stop and see if there's questions. I know y'all are on a tight schedule.
Yeah, sorry to rush us
That's
through
okay.
this. We're just trying to make sure everyone has a voice.
Yeah.
Questions for Claudia? Go ahead.
So I realize that you probably can't give me an exact estimate, but with the Affordable Health Care Act, right, you probably had an uptick in the number of
Yes.
clients that you were serving. So I'm wondering if you could use that experience to estimate any potential changes that would come down through the federal health care laws.
We, our client base probably went up by about 300 a month or so because of the Affordable Care Act, and it has stayed steadily at that level because of bringing in new clients. When people have a change in life circumstances, their income changes, they need to come back, and we have to help them reapply for insurance. And then with the Medicaid managed care and all the changes there, we've had clients who we've had to see multiple times a year to help them through that. With the changes that are happening, even the discussion of the potential changes that are happening right now, we are busier. We really haven't measured or projected yet too much, but I think that if, depending on how things go at the federal level, if people need more help, I expect we would really get a lot busier. I don't really have a sense of what that might be. I'm hoping that people will be able to maintain their health insurance. But we certainly would have the ability to better publicize our services and to reach more people, but we sort of try to contain our outreach based on our capacity to serve because we don't want to turn anybody away, and we haven't had to do that yet. We find a way to squeeze people in. But it is whenever there's uncertainty, we get an increase in clients. I don't know if that really addressed your question, but any changes that happen, including with the Medicaid managed care, we always see an increase.
Erin?
And so what did you all get from us last year?
We got, I believe it was 13,000, I can't remember if it's 13,800 or 13,080.
Looks like 13,400.
Oh, okay. 13,000,
That's right.
400, which was a little bit less than the prior year.
Yeah,
About-
that was 14,000 the year
Yeah.
before.
6 years ago, it was 21,000,
Yeah.
but y'all have gotten to be more in demand. So,
Any other questions for Claudia? Okay.
can I just say one more thing?
Yes.
If anybody is watching this on TV and is uninsured right now, I would really encourage them to come see us or to call our office at 352-6533, and we can help them out. It's really important to get people into coverage now.
Great. Since UPTV is the most popular channel in Urbana, hopefully folks will
Y'all are
have heard
surprisingly
that.
popular. People
It's true,
see-
actually, in our, or at least in the study we did a number of years ago, they may not watch for long, but they frequently watch.
Yes.
Um,
So thank you for letting me do a PSA.
Yes.
But we really want to get
No
people
problem, thank you.
Thank you.
Okay, so next up, we have Isak from Courage Connection.
And Jason.
And Jason.
Yes, thank you so much for the opportunity to come and talk with you a little bit about the organization and where we are now. I'm Isak, this is Jason, and I'm primarily here for agency-level questions, and Jason's going to do the introduction and respond to questions that are specifically related to the grant and the program.
Hi. Courage Connection is known primarily as a domestic violence services provider. We provide services for victims, for their loved ones, and for the community in general via community education on domestic violence. Our mission is to provide a continuum of services so that individuals and families can achieve safety, stability, and self-sufficiency. So looking at the safety, our two primary services are our 24/7 hotline. Thanks to Claudia for breaking the ice, because yes, if people are watching, our hotline is 384-4390. And our emergency shelter, again, also available 24/7 for people. We also operate court advocacy. We have advocates in the courthouse who assist people with filling out orders of protection, providing them emotional support during court hearings. Looking at stability, we operate several units of transitional housing for people who are rebuilding the skills necessary to return to self-sufficiency. This included recently dedicating 11 beds to women who are exiting the Illinois Department of Corrections. We also provide counseling. free of cost for anyone that needs it. And then looking at self-sufficiency, these programs are not specifically for people who've experienced domestic violence or for anybody. We have a job training program at our resale store Connections over in Lincoln Square Mall. We operate several low-cost permanent housing sites where we own the property and we act as the landlord. We also have a rapid rehousing program where we provide financial assistance for obtaining housing, and we provide case management so people can maintain that self-sufficiency. Courage Connection has operated since 1971 under a number of different names, but that puts us as one of the oldest domestic violence services providers in the country. Part of that history included a merger several years ago, so one thing that is different from our application this year is historically we've been putting in 2 applications representing the history of that merger. This year we finally combined them to make life simpler for you and for us. So.
Great. And Isak, did you have anything to add? I think you have a minute. Okay.
I think you did a great job. Thank you.
Okay, great. Questions? Question? I have a question. What's the status of, so you said you combined the 2 in domestic violence services, and I see that you're asking for $34,000, which is close to what you received across the 2 last year. And no request for homeless services program. Could you give an update on your homeless services and the role that this application plays? And I may be a little bit out of date with the news on this, but I'd like to know what the latest is.
Was it you passing that to me? Or was
No.
that- okay.
So, as most of you know, in 2010, Center for Women in Transition and A Woman's Place merged into a single agency. And for whatever reasons at that time, the work didn't begin to actually create a single agency from that. The simple reality is that the primary reason that women become homeless is domestic violence. And that was part of the reason behind the merger. It's a natural extension. So one of the things that we've been working very hard on over the last year is really integrating the two different branches of what we do to create a single agency as well as more of a continuum of services. So we still have what was known as homeless services. We just simply now refer to that as transitional housing as one of many programs available to victims and survivors of domestic violence in our community.
Okay. And so what's the state of your transitional housing? I know there was some concern about state funding and the future of transitional housing for women. Could you provide an update?
At this point, we're doing everything we can to survive the general crisis. We've already raised about 1/3 of the funds that are missing from the state of Illinois. Indications are still that we will receive 2/3 to 100% of that funding. We're just not sure when. So the biggest challenge is just surviving sort of this interim time period. But we're also continuing to look at ways at how do we continue to consolidate our services, because the reality is we know the funding crisis isn't going to go away. But we have every intention of keeping our doors open, keeping the services on interruption, while we still look forward toward the future to figure out what do we need to do to still consolidate and save even more.
Okay, thank you. I saw a hand. I'm sorry. Who was it? Eric?
I think you've already addressed my question. I knew, or I guess I had heard of your issues with respect to state funding. And I'll just toss in something. Probably you know that last year we modified our zoning ordinance to make it, to open up more possibilities for transitional housing, so you can take note of that in the future.
We're actually investigating options in Urbana as we speak.
Okay, great. Well, we want you to do that, and we've made it a little bit easier to do that.
Okay. Other questions?
We've got about 10 seconds here.
Okay.
I'll make mine really quickly. Is that okay? So what percentage of your budget comes from the state?
It's 1/3 of our program budget and about 20%, 18% of the overall budget.
Okay, great. Thanks so much.
Thank you.
Next, we have Eastern Illinois Food Bank. Who's our rep?
And it's Kristen Bosch.
Kristen. Great. So we'll have, 4 minutes, and then for presentation, and 5 minutes,
5
for,
minutes for
presentation,
presentation,
and 4 minutes for question and answer.
Great.
Go ahead.
My name is Kristen Bosch. I'm representing Eastern Illinois Food Bank. I'm the Vice President of Development and Community Partnerships at our food bank here locally. We are the largest hunger relief organization throughout our 17-county service area. Our primary function is to provide consistent and adequate source of food for our network of more than 200 member agencies and programs. Those range in size from small church food pantries to large homeless shelters. All are working diligently to help struggling families make ends meet. To do that, the food bank acquires discounted and free product from food and grocery stores. That includes bread, canned goods, fresh produce, all sorts of pantry staples that everybody needs. That also includes personal hygiene products, non-food items. So those can also be found locally at those pantries that I mentioned earlier. In turn, those member agencies provide those items free of charge to those that are struggling with hunger. In Urbana, we have 17 member agencies, and those member agencies serve roughly about 7,100 people that are struggling. That's on a monthly basis. So again, I talked about those 17 agencies, and those range from everything from partnerships with local schools, like our food pantry at Urbana High School. We also have, food pantries at Stone Creek Church. And again, I included those in our application, but we've got a wide variety. So again, we work to alleviate hunger by increasing the accessibility of low-cost and free food. And to do that, we really have to subsidize our small nonprofit budget. We've requested $15,000 from the city of Urbana. That's about 1% of our overall budget, and that just goes to distribute food. So maintaining our staffing costs as well as our overhead of keeping fuel in our trucks, keeping those trucks on the road, maintenance, all that good stuff. So if there's any questions, I'm happy to answer those at this time.
Okay, thank you.
You're welcome.
Questions? Questions? Go ahead, Jim.
In the salaries and wages, what's an FTE?
Full-time employee.
Oh, okay. Thank you.
You're welcome.
Any other questions, Eric?
So I'll say something on your behalf that you didn't say, I think is right, is that you're very, very cost effective because you have many ways to get food way at cost, way below what people would get at the supermarket. So
Thank you. Yes, you're right.
So if people are asked to donate cans of food, you're going to get more bang for your buck by donating to the Eastern Illinois Food Bank.
That's correct. $1 to URI is $10 to Eastern Illinois Food Bank. And for $1, we can provide 5 meals for our neighbors in need. And that's just the way that we're able to procure food and the way that we're able to stretch a dollar. So I appreciate your plug for us there, Eric.
Any other questions? Yes?
How many employees do you have?
We have 24 full-time employees.
Yeah, Eric.
You also give me exercise tossing around these big boxes of food at the Garden Hills Food Pantry that you've brought there.
Thank you for your volunteerism.
And just to follow up on the 24 full-time employees, can you give the demographics of your employees as well?
Considering race and ethnicity,
Yes.
we have 4 African American employees, so that would be about 17%, and that is the only quote-unquote minority on staff.
Any other questions? Okay, thank you so much.
You're welcome.
Next, we'll hear from First Followers. Go ahead.
And Marlon Mitchell.
Mhm.
Good evening, everybody. So my name is Marlon Mitchell. I'm the founding co-director of First Followers, and First Followers is a not-for-profit organization here in Champaign, located in the Champaign 401 East Park Street. And what we do is we provide reentry service for those individuals who have that are returning home from incarceration. So most of what we do, what we've been doing since 2015, when the program first launched, is employment. And there's other critical needs that individuals need. We see people come through the doors that are needing housing and different critical needs, healthcare, and different things like that. So that's just a little bit about what First Followers is and what we do. I just wanted to talk a little bit about why we come to Urbana City Council for the ask. So me personally, I had an experience last summer with a group of summer youth employment programs here in Champaign County. And under this program, there was a set of black males that were not able to be placed in summer youth employment because of the criteria that they did not meet. So with our not-for-profit, what we did was stepped up to the plate, and we employed these 4 gentlemen who either have been criminal justice involved as teenagers, or they've been dropped out of school, or just those typical things that we hear too much about in our community. So, so through that, I was able to, and I come to you all asking if we can put together something like that, a pilot program where we can reach out to those individuals that are pushed to the margins many times because of historical events with the criminal justice system. And so, and I brought with me one of my peer mentors who has been with the group for about 1.5 years now, just to speak about some of his personal experiences as a troubled youth.
And everything else. My name is Perry Klein. I'm a peer mentor at First Followers. I'm also a senior at the University of Illinois, Bachelor's in Social Work program. And I just can attest, and Marlon, he hired me because, let me just get out the way, he hired me because it was hard for me getting a job. And when I heard about First Followers and they helped formerly incarcerated people, that was the first place that I went because I couldn't find, wouldn't say gainful employment, but the employment that I wanted and an employment that I thought I was worth. So actually Marlon gave me the opportunity, and he showed me the way to get back in school so I can get that opportunity, get those opportunities when I get the education. But also by being a peer mentor at First Followers, I sort of kind of found my calling, and that's to help people out just like me, who's got that stigma that's attached to them when they get out of prison, or when they go try to find and get a job, and they get that feeling that they not wanted. So I, as a peer mentor at First Flowers, I'm one of the first persons that they see come through the door, and somehow, you know, we build a rapport because I got the credibility and also got the identification to know what they're going through. So that eases the comfort when they come through the door, and then also always try to give them that support to let them know that you know somebody's got their back, because most of the time people just, you know, as long as they know they got that support, you know, they tend to open up more, and then you can help them more, and then they'll be able to open up with you and be honest with you, and then you can help them, because you can't help nobody if you don't know what's wrong with them. And a lot of people, you know, when you have that stigma, they usually are closed in and don't want to, you know, ask for help, or they don't know how to ask for help because they always getting the door shut in their face. So for me, and I can just say this, for the last 3 weeks, there was 8 people that came to the door looking for employment, and all 8 got employed. So that's a good thing for, you know, the last few weeks. But yeah.
Great, thank you. Questions? Yes, go ahead. Bill.
Yeah, on the budget, first of all, I saw you got money from Mental Health Board last year, the $29,000, or this current year, I guess. Was that for a full year, or was that for less than a full year?
That was for a full year.
And that'll probably double for next year?
That's the ask.
Okay, that hasn't been confirmed yet?
Correct.
Okay.
The reason, let me kind of speak to that a little bit. The reason is because we've seen, you know, traffic flow is starting to pick up. At this particular time, we have 8 or 9 mentors down at the center. We have 2 paid mentors that actually come in, and the rest are volunteer. So that's one of the asks. And also, with the traffic that's picking up, there's also other projects that we would like to do that that came out of a needs-based assessment that we did over the summer of 2016. So all these pilot projects that we're asking to do, in particular this one with the youth, are things that have spun out of our experiences for the last year and a half.
Okay, I understand it's hard getting started. You've only been going for a couple of years, but for the longer term, have you identified a few other sources you could use once you get going? as far as
Yes, we have.
grant
So
funding?
there's some national grant funders that we're looking at here locally. Of course, the County Mental Health Board and the cities of Champaign and Urbana. We haven't approached the city of Champaign because we missed that site.
Other questions? I just have a couple of questions. The first is, I know that you spoke about this, you did a year-long research project that was fairly intensive that shows clear needs for folks who are either at risk for being in the criminal justice system or folks coming out. And I'm wondering if you could share it with the trustees, because I think some of the context for your request comes from that. So if it's possible, if that hasn't been shared already, if you could send it to Kelly or someone at the city and distribute, I think that would be helpful.
Okay.
The second is, I want to, is this a summer program or is it throughout the whole year? I know you said it starts in July.
So what we're looking at is running a pilot program for 8 weeks.
Okay.
And what we're trying to do is we're trying to align it with local employers so that one of the things that we've been having conversations with is with the labor unions. Not only labor unions, but also minority business owners that can kind of identify with the issues that we have. And we've targeted those two groups because they are the groups that have said that they're looking for more participation from minorities. But at the same time, what we've been trying to do is we want to run this project because too many times I've seen holes or gaps in other programs where an individual will go into this earn as you learn model, and then they'll finish up that program, get a certificate, but won't be employed. So one of the things that we want to do is reach out to employers first to get that commitment to bring them on as either trainees or mentors, and they can kind of follow them around, give them a probationary of 90 days or something like that. And then we will also, with folks like Perry and the other mentors, will also serve as guides. It's like we're giving a handoff, but they're still staying attached to our program to make sure that we build that rapport, that credibility, and also help on the ends of any kind of difficulties or dilemmas that might come up.
That's time.
Okay, great. Thanks so much.
That's all?
Yes. And I believe if council members or trustees, I don't know which hat you're wearing this evening, have questions, you can send them to staff and they can send them out. So if we've run out of time, please feel free to reach out with your questions.
Yes, and we will make sure that they get sent to the agency and we'll get the questions answered for you.
Okay. Next, we have Prairie Center Health Systems.
And we have Carol Bradford.
Hi, Carol.
My name is Carol Bradford. I am the clinical director for Urbana's Prairie Center's Urbana Outpatient and Intensive Outpatient Substance Abuse Treatment Facility. And I am here to talk with you about our case management services that we provide, which is what our request to this particular body is for. Prairie Center's been around since 1968. We actually have 3 locations. We do serve Champaign, Ford, and Vermilion County. We have 3 full-time case managers that provide services to our clients that we serve. About 70 to 80% of our clients are below the federal poverty level. Many of them, when they come into treatment, are what we call couch surfers or homeless. This means they don't have any permanent housing. They are oftentimes sleeping on sofas, staying with family members and friends. One of the barriers to getting clean, staying off of drugs, and maintaining sobriety is having a stable, safe living environment. What our case managers do, besides transporting the clients to and from treatment, is that they also provide services such as helping the clients sign up for the Affordable Care Act health treatment through that service. They also will help them with getting ID, driver's license, state ID, birth certificate. Some of them don't have a Social Security card. All of those are barriers to getting housing. There are also barriers to employment. One of the main goals of case management is to reduce as many barriers as possible that may get in the way of a person being able to live a clean, sober life. Our case managers work with the clients by doing a case management assessment when they come into services. And based on that assessment, they determine what the client needs help with, and they do a service plan with them for case management. Typically, the top 3 items are housing, employment, and lack of health care coverage. So those are typically the main things, but they also help with locating child care resources, helping them sign up for different benefits in the community, making sure they're aware of what's out there. One of the biggest issues for those that are underserved is not having information about what is offered in their community. So our case managers work to make sure they know every service, whether it's LIHEAP, helping with utility bills, or connecting them to a food pantry to get food. They are trying to make sure they're on top of it so that the clients can get the support that they need. We have struggled lately with meeting the demand. We have so many clients that are in need, and oftentimes it's in multiple areas. And so even though they're coming to us for substance abuse treatment, without the case management services, we know that they would not be able to reach the goals that they have for themselves, whether it's related to substance abuse treatment or other issues going on in their life. And I'll take questions at this time.
Question?
Currently, if a person walks in off the street for substance abuse, how long is the wait?
That varies. Typically, we don't have a wait list. When we do, it is usually about 2 weeks. We do offer, actually one of the services our case manager's office offers is a group called Starting Point. What we try to do is make sure that even if our caseloads are full, we get the clients into some type of service immediately. So the reason I say we have a wait list, but they're not actually waiting, they will attend Starting Point group services until they're assigned to a counselor. That way they're connected to a case manager immediately, and we know that based on research, if they don't start services within 72 hours of getting up the courage to walk through the door, they're either going to go back out there and use, they're going to end up getting into legal trouble, or possibly OD. So even if we can't put them immediately onto an individual counselor's caseload, we get them started in Starting Point so they're receiving some services.
When you say 2 weeks, I guess, were you talking like a residential placement? Or
No. So this specific application was for our case manager at our outpatient location. When we have clients that need residential, you know, that's an issue in our community. Prairie Center actually has a residential treatment facility, and we do have a wait list for that program. We do have a priority list, and so our Champaign County folks are on the top of that list. So because we do actually get requests from all over the state, just because of the budget, there's hardly any residential treatment facilities left open now. But again, even if they're on the residential wait list, they're receiving some type of case management service or group service until they can get in.
It's good to know. Thank you.
Go ahead, Eric.
Do you have significant interactions with law enforcement?
Yes, we actually have several programs that work with law enforcement. We have a Champaign County Drug Court program. Those are people that have been court-ordered to participate in substance abuse treatment. And we also have a case manager that goes over to the county jail Monday through Thursday to do substance abuse screenings. So she gets the booking list. She also will coordinate with Rosecrans and other providers there to see if there are any clients that, or potential inmates who need to have substance abuse treatment. One of the things that she does is if they do agree to do a screening, she'll get their contact information. Once she notices that they're gone, so she checks that list if they've been released.
That's time.
Okay, she'll call or email or go by and see them and try and get them in to get an actual assessment done.
Okay, great. Thanks so much. Next, we have Rosencrantz. Who's the rep from Rosencrantz?
We have Sheila Ferguson and Julie Cartel.
Sheila and Julie.
Good evening. We actually have two programs, so I'll try to move pretty quickly through them so you get a chance to answer some or ask some questions. First, I'm going to talk about the Men's Transitional Housing Program. This is formerly the Time Center Level 2 program. It's a program that assists adult men over the age of 18 in Champaign County in providing us really a safe temporary living situation for those who'd otherwise live on the streets. There we're offering transitional housing in terms of shelter, but also supportive case management, individual counseling, and support plan development, food meals, assessments, and service linkages. Our funding tends to come from various sources, but to answer some of the questions you've asked others is our total budget is $279,000, and the request that we're making tonight is for about 12.5% of that. Transitional Level 2 program is made up of 8 funding sources. So you can see the situation in terms of the funding from the state has been less than stable, and certainly it's been piecemeal for maintaining the program. Our demographics, of course, are 100% male. Our race breakdown is 64% Caucasian and 36% African American. And the ages tend to range from 79% that are between 19 and 59 to 9% between 60 and 61. And we have 12% that we serve 62 and older. Income levels tend to be $12,000 or less, generally speaking. And again, we're asking tonight for support for a case management position at the shelter. The second program I wanted to talk about was the Runaway and Homeless Youth Program, and this program is a program that provides an array of housing and supportive services to youth and young adults 16 through 24 who are at risk of homelessness or need assistance with transitioning to adulthood, with the goal of addressing their needs and helping them to make a successful transition into independent living. The funding there comes from primarily 3 sources, and tonight we're asking for $12,867 from this group, and that makes up about 7% of the total budget. Here we're serving primarily, we have 3 pieces to the program. We actually own and operate 2 housing pieces. You may recall Roundhouse. Roundhouse has been repurposed to help for young women, usually either pregnant or parenting, move to independence. And we also purchased a home from Homestead Corporation in 2013, where we assist young families with transitioning in out of homelessness. We have a full-time case manager who manages both those homes along with a caseload of about 22 individuals. So we serve both people with housing and young people without housing that need the type of support that we're offering. Currently we have 8 folks that are housed, and at the house, the independent house in Urbana, we have one head of household female with a small child. Both programs really support individuals in terms of reducing the barriers to homelessness, and they both have time limits. And so you have up to 24 months to work in most cases with the case manager to break down those barriers. And for Champaign and Urbana, or for the county as a whole, to have 2 years of adequate rental and landlord history makes it possible to have apartments in the community too. So we understand the length of time needed, but also breaking down those barriers, whatever those are. And as many people have talked tonight, it's a myriad of community providers that support us, from food to Champaign County Healthcare Consumers Benefits and so on. Thank you.
Okay. Questions? Yes, Jared?
In the Runaway and Homeless Youth Program, how do you guys end up coming into contact with those individuals that you end up serving?
We actually do some street outreach work and some motivational interviewing. Sometimes it's about building the relationships with those young people. We do travel a lot of the places where we know that they are possibly congregating or passing through and some common places that the officers actually also identify for us. We tend to be non-threatening because we can offer supports without requiring anybody to participate to any level. And there's no expectation, it's voluntary.
And the schools are aware of us, and other social service providers are aware of the services. So and word of mouth is huge among the youth on the street. So,
Other questions, Aaron?
So Rosecrans took over from the Time Center, right? Took over the Time Center.
Rosecrans merged, well, we actually, Community Elements merged into Rosecrans, the entire organization, yes.
So the homelessness, the beds that Time Center once had, will you have the equivalent of that? Does this funding help you get back to that?
No, this funding only supports the 20 beds that are in the transitional program. When HUD moved to rapid rehousing, we lost all of that funding, as did many other agencies that did transitional and shelter type services. There is no possibility of it returning unless those funding sources determine that shelter would be something that they're interested in providing. There has been more support for transitional housing, and we're hoping with state budget issues that they continue to focus on transitional housing. But there are some models out there, and there are certainly communities that are moving to more permanent housing first models.
And so how many employees do you have at Rosecrans now?
We currently have about 105 employees. We're down from about 160 this time last year.
Is this all Champaign County? The employees?
No, we actually have people from surrounding communities as well. Not very many, but primarily Champaign County, one or two from outside of that are driving 30 to 45 minutes.
And so what would be the breakdown, the racial, ethnic breakdown of the employees at Rosecrans?
I can send you a full breakdown of it. I was just asking Julie, and we both don't have it right in front of us with the new number that we have, but I can get that to the council.
Okay.
I just have a quick question with the closure of the emergency shelter. Obviously, emergency shelters are urgent need in our community. What is there a possibility to increase your transitional housing? Since you're asking for a similar amount to what you received last year, you're asking for more than you received last year, but last year we were serving both transitional and emergency shelters. So the question is, what role can you play in helping to expand services for the homeless in our community? This looks like it's basically status quo with the transitional shelter, and it's not really looking at an expansion. So overall, you've actually contracted in terms of what services you're offering.
Time is up.
We contracted in services, but also in funding, and so I don't know how to answer the question. Every funding source that probably is true for anybody receiving state funding right now is up in the air with no payments that have been made since January. We don't have any guaranteed contracts at this point for next year. We continue to be very involved with the continuum of care and do everything that we can to help support housing and certainly people moving out of homelessness. But I can't answer your question without some certainty around that. If we were to receive the same amount as we had in past years, I would say we would continue to do at least as much as we're doing right now. There are some things that are passed on to us in terms of costs for facilities and so on, but you know, our staff is really dedicated to helping this group of individuals because we know that many of them also have issues related to mental health and substance abuse, and if we can help break down those barriers, then people won't need us for as long, and so those transitional openings will come more frequently. That's our goal.
Thanks. Thanks so much.
Thank you.
Next, University YMCA.
Mike Doyle.
Mike Doyle.
Good evening. Thank you for having us. I have Carmen Lohr, who's one of our volunteers, joining us tonight, and she'll say a few words after me. First of all, I want to thank the City of Urbana and this council for the work that you do in supporting the needs. As you sit in the audience and hear people talking, it's kind of daunting and appreciate the difficult choices you face in selecting who to be able to fund and at what level. The university-wide this past year was selected to be one of 12 communities to help develop a New American Welcome Center. Our proposal coming to you tonight is under that initiative. The Welcome Center itself is really a broad community-based initiative, bringing together key stakeholders to look at how we can make our community more welcoming for immigrants who are here and who might be coming in the future. This summer we'll be doing a number of listening sessions in targeted immigrant communities, as well as doing some asset mapping with the various stakeholders who have signed up to participate in this. Our request before you, though, is for La Línea, which is a Spanish language community helpline that was started in 2011 at the University Y. Immigrants who come into our community face very unique challenges from other needy populations, from language, issues of trust, issues of legal status. And the La Línea was created as a way to address the specific needs of those individuals. The model that it uses is one that's based after the Champaign County Healthcare Consumer Health Hotline that I was involved in 1980 and starting that, where it's really dependent upon developing a group of trained volunteers who can work with people in the community, people who come from the community, who work with community residents. Our goal is not only to assist people with the various needs that they have, but also to empower them and give them the skills and the knowledge to be able to advocate for themselves in the future. So we're really looking at making them self-reliant as much as possible. Over the last couple of years, La Línea has faced some real struggles. We get some support, or we were getting some support from the state of Illinois that then was cut off. It's now been started up at a smaller level. We saw our numbers in 2016 from helping 257 individuals, or about 21 people a month, down to the current fiscal year where we're only able to average 9 persons, and that reflects really our lack of ability to get out in the community and have the volunteers that are supporting people as needed. The request I want to note, on the front page it says we're asking for $59,000. Just clarification, I think we're actually asking for $29,000 when it has sources of income. That $59,000 is the amount we allocated toward the program being done here in Urbana. So I don't know if we got that right on the application or not, but our request is for less than what's on page 3 there. I now want to turn it over for Carmen, who's a volunteer. These are one of the individuals, Carmen's one of the individuals who has works with people in the community. When we get a call in, we assign them to community volunteers such as Carmen. So I'm going to have her say a few words.
Hi, everyone. I have been a volunteer for La Línea for almost 2 years now, and I'm here to tell you what a wonderful impact a program like this has in our community. During my time as a volunteer, I have witnessed positive results for a case of severe bullying. Mom did not know where to go or who to talk to, so she called La Línea, where she was giving all the support and information she needed. She got a hold of school officials, and bullying stopped. She personally came to one of our workshops to let us know how immensely grateful she was. I have personally been involved in a case of domestic violence. Since calling La Línea, this lady was able to leave her home, place a restraining order against her partner, and get custody of her kids. The amazing difference I have noticed in her since our first meeting makes my time volunteering at La Línea worth it. These are only a couple of cases I have seen, but there are countless others. La Línea and its work can make a huge difference in our community. Please consider supporting it.
Thank you. Questions? Any questions for the Y? Yeah, Eric?
So, thanks for the presentation, Mike, and thank you, Carmen. The immigrant hotline, basically, the Welcome Center, typically we hear, and we speak of immigration and we think about the Latino community, right? How, can you elaborate on if it's broader than that?
So, I mean, what's interesting in terms of our immigrant community, almost 1 out of 5 people, I think it's 18.7% of the residents of the city of Urbana are foreign-born, meaning they were born somewhere else and have located in the city of Urbana. So it's a significant portion of our population. In terms of immediate immigrants who have recently arrived, the largest is probably Chinese and Korean, but we also have a large Congolese population, as you probably know, as well as Mexican, and then there's a pretty significant Guatemalan population. So there are several different types of immigrant communities, both in terms of language and where they come from, but also how long they've been here. So there's a number of immigrants who have been here for decades and are citizens of the United States, which is, I think, another thing people often don't understand about the immigrant community.
And if I could add to it, we also support the community in French. We have an outreach, and we have a lot of immigration from Africa, and they're French-speaking countries, and we actually have access to that. There's also, if there's a need for a different language, we look for that interpreter, we look for that language, and we try to accommodate anyone that comes calling La Linea services.
Yeah, I think that's one of the expansions that we want to be able to do, is to add more languages and volunteers who speak different languages in our community.
So as the Welcome Center, like various other organizations, but it sounds like you all are able to, are you connecting the immigrant community to, or the people who come, who call the hotline or come to the Welcome Center, to the other services, or are you supplying the services?
We do a little bit of both. I mean, our connecting is really advocacy. So like the Healthcare Consumer Hotline, when people come to us, they have all kinds of issues and challenges. Immigrants face certain specific ones that other people don't do. So we work with them and advocate with them. So sometimes we're advocating with an agency to get them to give services to them, or advocating with a government agency. So it isn't always providing services in the sense of we don't give health care, we don't do food pantry, things like that. We do have a small emergency fund for immigrant families that are in crisis that we provide money as they need it. But so our role is really working with immigrants in the community, advocating with them, helping them get the services they need, and hopefully educating them along the way about how they can do that for themselves in the future.
Great. Any other questions?
You got about
Eric,
10
go
seconds here.
Yeah.
How do you sort of integrate or interface with the center that HAHO directs? I mean, you're providing similar, but
Right.
they should complement each other. Maybe you could
Yeah,
talk
we
about
work
that a little
closely
bit.
with HAHO and the Refugee Center, ESERMAC. Part of it is the relationships that agencies end up developing through the contacts with that. So I think in some ways there's probably some overlap in the different agencies, the individuals and communities that we serve. I think ours got started really out of the need that people weren't getting the services that they needed, whether that was a lack of capacity within the community or not. So I think for us, I think also we provide it through a hotline where people can call in and we get back to them, as opposed to a walk-in service. So there's different ways, I think, of reaching in the community. We're also trying to work with, as we do listening sessions, of getting out in the community and identifying certain needs that aren't currently being addressed. But we collaborate with all different agencies. Part of the Welcoming Center itself is to identify a broad range of stakeholders where we're all coming together and identifying how we can address those. I think the request we're asking for tonight is specifically for La Linea and working with individuals and connecting them with services.
Okay. I know we're out of time, but it looks like we're ahead by a few minutes. So I just want to check, because I thought I saw another hand up. Okay. So we're good? Oh, Jared, go ahead.
Hey, Mike, I was just gonna ask, since the 59,000 that's in here is not actually what you're requesting, you're actually requesting
Well, so I think
29,000?
the whole proposal is for the program is 99,000. In there it says how much of this is to support Urbana, which is 59,000, which is 60% of the overall program.
Okay.
We were requesting half of that amount for the part that's being served in Urbana, so it's $29,971, and it's in the grant in a different location.
Okay.
So I think that might be a mistake on our part in terms of how the person who worked on the grant saw the question about how much is this supporting Urbana versus how much is being requested from the city of Urbana.
Okay.
If that makes sense.
Yeah, so folks should update their charts that now say a request for about 59 plus to 29,000.
29,971.
Okay. Thanks so much.
Thank you.
We could also do an update on the Excel and spread it out,
Okay.
send it out.
Wonderful. Thanks. So next we'll hear from Urbana Neighborhood Connection Center.
It'll be Janice Mitchell and Beth Hand.
Okay. Janice and Beth, welcome.
Good evening. I'm Janice Mitchell, and I'm the founder and executive director of Urbana Neighborhood Connection Center. This is Beth Hand, who is the coordinator of our educational services, and also we have Kiana Lampkin, who is our coordinator for our teen services. First of all, I would like to just continue to just thank our city and township for all of the support that you've rendered since our beginning, actually in the process of even getting started, which was about 7.5 years ago. every opportunity that I get, I'd love to just be able to show the progress. And I know in this case, I have to do that within probably 2 minutes so that Beth can share a little bit about our academic services and Kiana can share in terms of our teen services. We actually have 2 program proposals also, which we're requesting funding for. One is the Urbana Youth Development Program, which is a college and career readiness program, which we are currently serving 25 students in, 10 of which are Urbana, and they are not, the difference is it is not dependent on income. The other portion is funded through the WIOA grant, and that is income eligibility, and so all the other students are funded through that funding source. We prepare the students everywhere from learning how to write the essays, going on the college tours, searching for scholarships, help assisting where it comes to cap and gowns and other areas of preparing them for graduation. We also work with the WorkNet Center out on Mattis, so we do bring in speakers and other business persons from our community. So I know that's just a little bit about that program. The other is our Community Study Center, which is located pretty much the majority of our activities are located at 1401 East Main Street. Many of you remember that was the Harley-Davidson building, and then it was purchased by the Housing Authority of Champaign County. The building is still owned and used by the Housing Authority of Champaign County. However, in a partnership, we are still using the front portion and kind of some of the back portion. I take great pride in saying from our early beginnings, where we had 7 students, many of you were on the city council at that time and did a walkthrough. We had 7 students for our first 3 to 4 months in operation. We currently have 88 students in our after-school program, and on a daily basis, we have about 75, 76 in attendance. Our largest support system, I will say, comes through by way of Urbana School District, because we are able to partner with the teachers, our principals, and all of our work is connected directly with the schools for after school. Our students of the 88, 100% of the 88 are Urbana students from across our elementaries, middle school, and high school in Urbana. During the summer months, we have a 9-week summer camp, and so I would say we have anywhere from 100, maybe about 120 students, and maybe out of those students, we may have 10 to 15 that may not be Urbana. This summer, it's a problem, but I guess it's a good problem to have, which is given our current numbers, as it stands right now, we will be serving majority of Urbana because we're only going to even open up for new students, maybe take in 15 new students this summer who are looking for summer programming. So I want to stop because I'd like for Beth Hand to just talk very briefly in terms of how our academic services.
One of the projects we did this winter was to do some assessments of reading and math for all the students so that we were able to target their learning specifically for what they need to do. So when they come in after school and they say, oh, I don't have any homework now, we've got some materials available. And the fun thing is they're like, oh, can we use our EduCarts yet? So they're receiving a lot of academic services currently.
And Kiana is going to talk more. So there was an increase in funding that was requested of $5,000. That funding is to help provide additional space at the Independent Media Center, where we have currently worked very, very hard to partner with them so that we could use some of their public space downstairs.
So very briefly, the program is able to offer additional services to over 20 more participants. And so in that time frame, we're able to work in partnership with the high school and with the middle school to make sure that we are working very closely on their academic services, so we're able to provide the students with additional assistance in missing assignments, failing grades, things like that. In addition to that, offer activities and support services for those who do not need additional services in the academic time.
Thank you. Questions, Aaron?
How do the students get to Neighborhood Connections?
Our elementary students ride the First Student buses. We currently have students from pretty much every elementary building in our district, and they ride, parents pay $1 per day for students to ride the bus. Our middle school students, for the ones, because we still have a few that come over to 1401 East Main for specific academic reasons, they actually ride the MTD bus. Now that we are partnering with the IMC, the majority of our students are just kind of walking from Urbana Middle School and come straight to the IMC building.
And what percentage of the 88 are middle school and high school, if you can give us a breakdown of that?
I would say about 75. I'm sorry.
They said I wasn't speaking into the mic.
Okay, probably about 75% are probably our elementary students. And right now, because we are building, our numbers at the IMC are what we're calling our Teen Connection Center. We have the fewer students there, but we know it's going to grow. The flyer that we passed out, we did not have it at the time that we submitted the application, so that's why we sent that around.
To give a rough number, we have maybe about 10 high school, 10 middle school, and it kind of goes up from there, roughly, that come daily.
Great. We just have a moment if there's any other urgent questions. Could take them. Okay, great. Thanks so much.
Thank you.
And last but not least, Urbana Park District.
It's Ellen Kirsanoff.
Okay. Elton.
Good evening. Thank you very much for allowing us to come present this. We're seeking funding for our summer youth employment program at the Urbana Park District. The program is jointly operated between the Urbana School District and the Community Coalition. We've been real active with the Community Coalition since its inception, and we work really closely to support their goals. Through this grant program, what we're seeking is funding to allow the Urbana Park District to expand and extend the students that are hired through the Youth Summer Employment Program at the Park District. The program exists that they can work 6 weeks of employment and approximately 20 hours a week. The funding that we would get through this program would extend the 6 weeks to 12 weeks of employment, and from 20 hours a week to 40 hours a week. All of the funding would go directly to the Youth Summer Employment employees. So it's really just to give them a broader opportunity to earn more money, but also a greater experience in the work field. The positions that are funded through this were created for the Youth Summer Employment Program. So we're not replacing other seasonal employees that we would hire. These programs or these positions were created for this. They're really entry-level positions, and they provide job skill training and have learning components for the employees. So it's a combination of job skills that hopefully will give them employment history, give them skills that can go forward and be built on for future employment. The students enroll in the Youth Summer Employment Program through the school district. The Park District sends staff over to the school district to actually work with those students to go through the online application process, make the application, and start as an employee would through the online process that we do. The dollars received, like I said, will make the employment more valuable, we think, for those students that are employed. They will work closely with our frontline staff and gain a real experience of what working with the public is like. The Park District is a significant employer of youth in the community and have been for our entire history of over 100 years. So I think we're well suited for this kind of program and well suited to give this opportunity to the students that participate in the program. I can answer any questions that you might have.
Questions? I'll take stack because it looks like several. So Eric, Bill,
Okay.
Dennis, Jared, Aaron. And I have a question too, so I'm going to add myself to
Okay.
the stack unless they get to mine.
Good thing I
So
kept it
let's,
short.
if we could be really brief, I'd appreciate it.
So I have two quick questions. One is, are the youth whom you employ in the at-risk category?
The majority of them are.
Okay.
the Community Coalition directs them to us, so they're working with these students already.
And the second question is, how did you arrive at the decision to extend the duration of the employment and the hours as opposed to being able to serve more youngsters?
That is a question I really can't answer. I think that was a decision based on the leadership team at the Park District looking at the positions that we created. The positions are across the board at the Park District. We hire these students. They work at the lake house, working with the public. They work at the aquatic center. They work in recreation programs. And I think it was felt that that was what we could take in those particular areas. I cannot give any more than that direction, but I'd be happy to find out and send that information to you. Yeah.
Okay. And next is Bill.
Did you say this was for 4 youth? How many?
Last year we hired 5. I
5.
think we're going to try and hire 1 or 2 more, but it depends on the candidates we have and what the community coalitions.
And last year it was for 6 weeks, is that right?
It was, but we ended up being able to extend it to 12 weeks.
Okay. 6 weeks, you just kind of get in the hang of things, I guess.
Right. That's
so
what we thought.
Of the 4 that were, or the 5 that were hired, how many applications did you get? Do you know?
I do not. I do not know the total application number that we had. And again, it partly comes through the regular system, but it also is a recommendation from the Urbana High School and the Community Coalition. So I think that narrows the scope a little bit of the applications that we get.
Okay, thanks.
But I'd be happy to send you the information.
Dennis?
My question got answered.
Thanks. Jared?
I don't have a packet with a breakdown of your guys' funding sources. Does the UPD contribute to this program as well?
We do. Yeah, we do. The Community Coalition funds the 6 weeks. We fund some of the hours, and I couldn't give you the direct breakdown, but the Park District does put tax support and some of our fee structure toward this. We use some of that money. So that's what gives them the 20 hours, 6 weeks, is the combination of that. This will just extend that time, the grant funding. But the Park District does put money toward it. Yes, they do.
Okay, thank you.
Aaron?
So you said you guys did 6 weeks for 20 hours, and now you're trying to do 12 weeks for how many hours?
For close to 40, if we can do it. So we're really hoping to double it. A lot of the initial cost to get them hired, trained, is up front. So once they're in and working, then it's less expensive to extend them than it is to start them.
Yeah, I don't want to extend this conversation further
Sure.
than it has to be. Maybe we could get some information from you on how many students from last year will come back.
Sure.
So I didn't know from a community coalition standpoint, with looking for at-risk youth, if you try to keep them or if you try to recycle, so to speak, and another group comes in.
Right.
And I was going to ask a little bit about training time, but I think you touched on that. What portion of that funding or that time do you spend on training?
Okay.
So that's something you don't have to get into all of that
Sure.
right now, but
Yeah.
if you could send me an email with some of that breakdown, that
Yeah.
would be helpful.
Oh,
It's
I could
actually questions I would have for a lot of the organizations who do summer youth employment, but you just happen to be sitting here. Thank you.
Sure. No problem. I can happily send that to you.
Okay, thank you. I just had a couple of questions. I didn't see there's a missing part of the application about the income levels. You had mentioned they were at risk, but we have a really specific kind of breakdown of what that means at different income levels. And so, is there a way that we could get that information
Sure.
that's missing from the application? And then the next question is, could you answer the question around employees and demographics? How many employees the Park District has? And
Sure.
the racial and ethnic breakdown of those employees, and you could send that. I know there's a number of employees, so if you need to send it, that would be great.
Yeah.
But I think we'd like that information, and if you could break it down part-time and full-time.
We have that.
Okay, so it's
Yeah.
not just a seasonal person is counted the same as a full-time year-round?
No.
Okay.
Right. Yeah, no, they're not. We have 52 full-time year-round, and then we have depending on the season. If you counted seasonal totally, we're probably in the 250 range plus of seasonal employees, and those are people that, work 6 months, 8 months, part-time. So we have all the demographics on that.
Okay, yeah, if you could send, and then the last question is, it sounds like these are youth who are working for the Park District, providing benefit as workers. So my question is, why wouldn't you simply hire them and pay them as you would any workers? Why is why is the stipend needed to purchase the services of someone who's providing a benefit directly to the Park District?
Most of these are very entry-level positions, and most of these youth that we hire would not have one or two of the qualifications that we would need for even a seasonal employee.
Okay.
So that's why there's a component of education and training that's higher in these positions than there is for some of our other entry-level positions, because a lot of the people who are hired into these positions would not even be hired because either they don't have the job skills, they would just not make that cut in an interview. We actually sit down with them and do mock interviews. We teach them what they need to know to hold that first time job. So the Community Coalition really helps us to identify those kids that need the skills to even make it through an interview.
Okay.
So that's why we need this program, because we're employing those and giving them an opportunity that struggle to get that first job.
Okay. This might be a question for staff, but the Community Coalition, is that a Champaign thing, or is it something Champaign-Urbana funds?
It's a county-wide, or at least Champaign-Urbana.
Yeah, it is I believe it's a pool. It's pooled. I know the Park District contributes finances to the Community Coalition. I believe Champaign Park District does too, and I believe a number of different sources contribute to that.
I believe that the police departments are involved initially with the Community Coalition, and I think this is like a program part of that.
So does it mean that the 4 who are identified, would they be Urbana residents?
Yes, they would be, because we work with the Urbana School District on this. I know there are youth summer employment programs in other entities in Champaign County. So, but we've agreed to take this many because we feel this is what we can handle as an entry-level position and stuff. But this happens in Champaign. It happens, I know Champaign Park District has youth summer employees that they work with, but we're channeling through the Urbana School District.
Okay.
That's where ours are coming from.
Yeah, I think it's mostly Champaign, but I think there are a few entities that are involved with Urbana. I know the Housing Authority is involved with it as well.
Okay.
In providing youth.
Okay. Were there any other hands? We have we're a little bit ahead of time, so. Okay. So, well, thank you. Thank you, Etlin.
Sure.
Appreciate it.
You're
we
welcome.
have a few questions, or a few minutes before we adjourn, and I just want to give folks an opportunity to ask anybody in the audience questions, if you had any follow-up questions. I think some folks had left, but we retained most of the reps who are here tonight. Any additional questions? Okay.
I have a general question. I don't know who would want to answer it, but it's bugging me because I hear a lot about case management, and I understand that case management is extremely important. But in a community our size, and thinking about some of the individuals who walk into any of your social service agencies and receive the services that you provide, I'm curious as to how many of those people then leave there going to another social service organization and also have to get case management there. So I'm trying to, I know that there was this idea of continuum care. I think somebody mentioned that earlier. You know, how much of that alleviates a lot of overlapping and how much of it is just absolutely impossible to avoid? But it just seems to me with case management being the bulk of the money that's being requested, how much of that can we be more efficient with?
Yeah, that's actually a great question, and I think the answer to that has actually changed over the last few years. Agencies around Champaign and Urbana, Champaign County, have really, I think, in the last few years, made a concerted effort to really sort of play better as a community. And the community relationships, the community partnerships are growing, especially as confidentiality is becoming a stronger and stronger factor. Agencies have to work together to be able to provide the services. And so it kind of depends on what the need of the client is. So for example, with us, obviously we have case management for somebody who is struggling because they're fleeing domestic violence, but they might have a kid in crisis nursery. They might have some substance abuse issues and are working with Prairie Center. They might have case management perhaps even with Child Protective Services. The biggest thing is most of them sort of have a home base when it comes to where their primary services are, and then there's a waiver of confidentiality so that the agencies can actually work together, because it's not about a duplication of services, it's about the fact that people really do have complicated needs. And as we are seeing sort of statewide, nationally, just a reduced amount of funding for human services in general, and we're seeing increases with struggle with mental illness and substance abuse, and I don't know that it's an increase in family violence, but certainly an increased awareness of it. But I think we are seeing an increase in the severity of it. So the issues become more and more challenging. And so it's not so much a duplication of services as it is about partnerships between agencies where the case managers are working together very openly with the client to make sure the different aspects of their personal needs are being met in a way that really does provide a more comprehensive service. And I really have seen a change in our community in that regard over the 3 years that I've been at Courage Connection, and I think it really bodes well. We're doing a much better job about building bridges, about making sure that the services provided are meeting as many of our client needs as possible.
Okay.
Yes, Eric?
So do you think we will ever see a request to fund an interagency case management consortium?
I would love that.
Okay.
But part of it is like, so I went to a conference, a national conference regarding family violence, predominantly sexual assault and domestic violence. And in other states, the states are actually funding community-based responses. And so the states are funding in communities sort of an entry point where people can go for services, and there they'll find Child Protective Services, domestic violence services, sexual assault, potentially probation, and other services all in one location. But that's something that's really being funded at a state level, because when you bring all of those services together, then people actually have better access to services. One of the challenges that we have are, even though there's a tremendous amount of services, they're really disparate, and that coordination is hard. So states are making a concerted effort about really providing community responses so that people can not only get their needs met, they can get their needs met promptly and safely in much less time and with much less effort on their part. And unfortunately in Illinois, we're really in a position where we're just trying to figure out how do we keep our agencies open, let alone how do we get our agencies to work well together and really create consolidated services. So I'd say the national movement really is starting to move in that direction, but unfortunately here we're a little bit behind the power curve, because that has to be funded at a really substantial level, and it really needs to be led by the state, or the communities have to find a tremendous amount of infrastructural financing to make that happen at a community level.
Dennis, and I think that'll be our last question. Go ahead.
Okay.
And so, yes, quite a few years ago, I pictured consolidating community services in, a single building, and that way the providers could actually share the expense of the building without duplicating, housing or business office space. If there was a building in town that was available at low cost, or vacant and could be rented or leased, would you think there be the consortium of services be interested in actually coalescing into one location, or would that be unlikely because of their divergent backgrounds? And
I think a lot of agencies would really be interested in being able to provide some of those co-located services. I think, though, it's a much more challenging conversation. because you don't want to be in a position where everybody's receiving the same services. So, for example, if you have somebody who is convicted or is accused of sexually abusing a child, you don't want them to be receiving their services in the same physical location as the mother and the child, for example. So you have to be really, really intentional about what services are provided in what location, and you still have to, it doesn't erase the need for the collaborative services regarding confidentiality. It can simplify it, but it still has to be driven by the needs of the client and their willingness to work together with those combined services.
Thank you.
Thank you.
I think we're at time. Thanks for providing the insight. Sometimes we need to think big picture about these things as well. So we're going to adjourn and come back as the town board in 15 minutes, correct?
Right.
Okay. Do we need a motion to adjourn? Okay. We are adjourned.